The most common cause of cough among children is a common cold or an upper respiratory infection that's usually viral in nature. Other causes include postnasal drip, asthma, pertussis, or lung infection, also known as pneumonia. Viral infection usually lasts for a few weeks and usually gets better without antibiotics. What do you need to do at home? Make sure that your child gets plenty of rest and fluids, avoid exposure to smoke, and take note that cough medicines are not recommended as they lack proven efficiency. Honey can be given if your child is more than 1 year old. You could give 1 to 2 teaspoons of honey 30 minutes before bedtime. Some of the red flags that you should be aware of is when your child has trouble breathing, if he or she turns blue or very pale, becomes drowsy, or is choking. You should seek immediate medical consult if any of these are present. For any medical advice, please see your doctor.